My name is Victoria Allen,
And my name's Alaynna Hawkins.
and we did our presentation on preventing poisoning in toddlers. So, some relevant developmental factors are toddlers are inquisitive in nature. They have no awareness of their consequences. Toddlers become more mobile as they begin to walk, and they have immature body systems. So, toddlers are inclined to explore their area once they begin to walk. Around 12 months is when they start taking their first steps, and that's when the risk increase for poisoning. Toddlers have poor taste discrimination, which allows for the ingestion of chemicals that older children would find unpleasant. And their bodies have immature body systems, so they haven't developed the enzymes necessary in the stomach and the liver to process and excrete the poisons that they ingest.
So there are five common ways that toddlers are poisoned. The first one is ingestion of household cleaning items. Toddlers may accidentally consume medications, cleaning products, pesticides, or personal care items if they are left within their reach. Improperly stored medications, especially those that look like candy, are a major cause for poisoning in children. Exposure to toxic plants. Some household plants and outdoor plants contain toxic substances that can cause poisoning if chewed or swallowed. Inhalation of toxic fumes, cleaning chemicals, and carbon monoxide from faulty appliances can cause poisoning when inhaled. And then lastly, cleaning agents being absorbed through the skin or eyes. Certain pesticides, cleaning agents, and personal care products can be absorbed through the skin or cause burns and irritation when they come in contact with the eyes.
Some ways that you can prevent poisoning in toddlers. Top priority is medication safety. Store all medications in a cabinet with a safety latch. Always keep medications in their original containers and never tell a child that medication is or tastes like candy. You also can store your cleaning products and cosmetic out of reach of toddlers and keep all cleaning products in their original containers. Lock up all products that contain alcohol. Know the names of your household plants. That includes anything with like holly or tulips. Those have toxins that are poisonous to toddlers when they're ingested. And store all keep all button batteries out of reach of children. They have corrosive material and they can cause stomach.
Alrighty, so some signs and symptoms of poisoning toddlers. They can present in a variety of different ways depending on the type and amount of toxin ingested. So some common ones include the gastrointestinal symptoms, so nausea, vomiting, diarrhea, or abdominal pain. We have neurological symptoms, drowsiness, confusion, seizures, dizziness, loss of consciousness. Respiratory symptoms, difficulty breathing, wheezing, coughing. Cardiovascular systems, symptoms, irregular heartbeat, and low blood pressure. And then lastly, skin and mucosal symptoms, burns around the mouth if corrosive substances were ingested and excessive drooling.
If you suspect your child has been poisoned, or just to keep this number on file, number one priority, who to call, keep the number for poison control near or in your phone. The number is 1-800-222-1222, and ensure all family members in the house know that number and know how to access the number. Another number handy is obviously 911, and keep their pediatrician's number near or in your phone.
Alrighty, so what are we going to monitor? So if a toddler has been poisoned, careful monitoring is essential to detect worsening symptoms and guide medical intervention. So the first thing you want to look at is their vital signs. So you want to look at their respiratory rate and oxygen levels. You want to watch for difficulty breathing, wheezing, or slowed breathing. Then we want to look at their neurological symptoms, so level of consciousness. Monitor for drowsiness, confusion, seizures, or loss of consciousness. Muscle movement, look for tremors, weakness, or abnormal movements, which may indicate neurotoxicity. Our gastrointestinal symptoms, as I said before, vomiting or diarrhea, which can lead to severe dehydration or can indicate severe poisoning. Abdominal pain or bloating, these symptoms can suggest internal injury or toxin absorption. Then we're going to look at their skin and mucosal changes because certain poisons like caustic cleaners may cause visible changes. And then lastly, we want to look at their urine output and hydration because that can indicate dehydration or kidney damage.
What you could do to help prevent poisoning in your toddler is to learn CPR slash the Heimlich. Oftentimes, toddlers will take little corrosive blunt batteries, they'll eat them. The Heimlich maneuver will help to cough that up and prevent any further issues. Take preventative measures. For more information, visit www.poison.org for a full list of toxic materials. And most importantly, we're looking to keep your child safe. I'm Victoria Allen.
And I am Alaynna Hawkins.